Sickness and vomiting symptoms during pregnancy start within a 3-day timeframe. Analysts from the University of Warwick have limited the time span that sickness and regurgitating during pregnancy will conceivably begin to only 3 days for most ladies, opening up the opportunities for researchers to recognize a natural reason for the condition. By estimating the beginning of side effects from a lady's date of ovulation, interestingly, as opposed to last feminine period, they have exhibited that manifestations start before in pregnancy than recently suspected, and inside a more modest time period. Queasiness and retching in pregnancy, regularly alluded to as pregnancy infection, which as a rule closes by 12 to 14 weeks of pregnancy, is capable by most ladies during pregnancy, albeit some will encounter it all the more harshly, as on account of hyperemesis gravidarum, when the manifestations can proceed all through the pregnancy. The reason has verifiably regularly been viewed as mental, yet this most recent investigation supports the view that the reason is natural and is connected to a particular formative phase of pregnancy. Specialists from Warwick Medical School and the Department of Statistics at the University of Warwick have reached their determinations from a one-of-a-kind dataset gathered at the Clear Blue Innovation Centre, by SPD Development Company Limited. Their outcomes, distributed in the diary BMC Pregnancy and Childbirth, distinguish a particular time span during pregnancy that could direct researchers toward an anatomical or biochemical reason for the condition. The date of a lady's last feminine period is usually used to gauge the beginning of pregnancy. However, their date of ovulation is believed to be a more precise beginning stage, as feminine cycles can change significantly among people, and even between cycles for a similar person. The specialists utilized information from everyday indication journals kept by 256 pregnant ladies to think about the beginning of their sickness and regurgitating manifestations to the date of their last feminine period and date of ovulation, as controlled by a p-test. Utilizing their date of ovulation as the beginning of pregnancy, most ladies encountered the primary side effects of pregnancy ailment following 8 to 10 days, contrasted with 20 to 30 days whenever estimated from their last feminine period. This not just exhibited that pregnancy infection begins sooner than past research has shown, however has additionally shown that utilizing date of ovulation limits the time span that manifestations start to 3 days, contrasted with 11 days if last feminine period is utilized. The exact course of pregnancy infection is obscure, however this examination shows that it's anything but a particular formative stage, in a particular time slot. For scientists, it limits our concentration as far as where we search for the reason. In the event that we realize that indications happen in a tight window 8 to 10 days after ovulation, analysts can focus their endeavors on that specific phase of advancement to discover the reason for the condition, both anatomically and biochemically. Roger Gadsby, lead author, professor, Warwick Medical School. Advanced medical care could help convey custom-made guidance to ladies encountering pregnancy challenges. Testing placental chemical levels can help recognize possibility for pregnancy entanglements. Pre-birth openness to air poisons may build baby's corpulence hazard. Before, ladies enduring with sickness and spewing in pregnancy have had their indications minimized and ignored on the grounds that it was thought there was a mental reason for the manifestations. This exploration further supports that nothing could be further from reality, that this is an organic issue identified with the advancement of the early hatchling. The examination additionally tracked down that 94% of ladies experienced indications of pregnancy affliction, a higher extent than past research that by and large ascertains the extent as closer to 80%. This is probably going to be on the grounds that information was routinely gathered from members before they got pregnant as long as 60 days after last feminine period, while most different investigations request that ladies review their indications after they have gotten pregnant. What we've shown is that a bigger number of individuals get indications of pregnancy disorder than ever displayed previously, and one reason for that will be that this examination has gotten gentle early manifestations that will in general blur by 7-2 months. In different examinations, those manifestations would have blurred when the exploration began.